Okay, so I am duly qualified, meaning, like you mentioned, I'm a speech therapist and an audiologist. So I did a 4-year degree at Wits with degrees combined. Currently, right now, it is a separate degree. So if you do want to study, you'd have to decide if you want to do speech therapy or audiology. It is offered at major universities. It is a tough program to get into just because of the small classes that they take. It's a very hands-on degree. So you have to be, willing to work with people, willing to put yourself out there, working in the government hospitals, clinics, schools. So that's the personality that you have to have. So someone that wants to help, give back, help individuals that need you the most when they have limited communication or hearing difficulties. Like I said, I have 2 degrees, which I'm really, really lucky to have because I can do speech therapy and I can do audiology. I do love my audiology a bit more, but I am able to assist with both. Being a speech therapist and an audiologist allows me to work with a very, very big range of patients. So you would find us in your neonatal wards with babies that have feeding difficulties, moms that are unable to breastfeed and latch properly. We're doing hearing screenings in the wards. You would find us in multiple departments in hospitals, in schools. We work with elderly individuals that have hearing loss, balance disorders. So the range of people we see is so broad. It's a very, very big range. But our aim is to improve communication. That's what a speech therapist will do, whether it be from a hearing point of view or from a speech point of view.
Very interesting, very interesting. Thank you so much for that information. And it is information that is going to be helpful for people who are watching right now and also listening. But now let us speak about, early, childhood. These things, do you develop them as you grow up, or it's something that you can be born with, be born with the challenges to hear and challenges to speak?
Okay, yes. So, excuse me, like I've said, we see individuals from the time that they are small. So, early childhood development focuses on the early years of a child's life. So, the most important period, we call it, when neuroplasticity is happening, so the brain is constantly learning things, is between the ages of 0 to 3. So we try and target and promote early intervention in those 3 years because it's the most crucial period in a child's life. So a child could be born with a hearing loss. It could be genetically inherited. Their mom could have been sick during the pregnancy. There could have been trauma. There's a lot of factors which we call risk factors. That's why we want to do hearing screenings for any baby as soon as possible. So that if we pick up a hearing loss, we can start the process for hearing aids, cochlear implants, whatever the management may be, because we want the child to have access to sound in those first 3 years, because that's where the brain is learning the most information. So you could, that's why early intervention is so important. So even like for speech therapy, there could have been risk factors that affected the child's learning development in those 3 years. So mom is working, mom's really busy, child at home with a nanny or a helper or a granny, and granny's busy, helper's busy, TV is on, the child is being stimulated by the TV and they're not actually playing. There is a lack of stimulation, so we may see language delays. We have seen cases where kids are so severely malnourished. There's lack of stimulation, whether it be from family, whether it be from schooling, and they're not having access to speech. And as they develop, they are not learning speech as much, so their brain is not absorbing that information, so they present with delays. So as soon as you as a parent, a teacher, a grandparent, an aunt or an uncle are concerned that there may be something happening, get help, seek intervention. You don't know where to go to your local clinic, go to a doctor, go to a nurse. Somebody will start that process, and you'll end up, possibly with a speech therapist. You may not end up with a speech therapist, but you may end up with a occupational therapist, and they'll send to us. So you want to start that early intervention process as soon as possible because of the brain development in those first 3 years.
Wow, thank you very much. Oh, hi. I'm Effie
Yeah.
Berry, by the way. So I wanted to know, what assessment methods do you use to identify specific communication needs? Let's say maybe assessment the methods that a mother could probably use at home to identify whether their kid has communication needs or the speech needs.
Okay, so in the Road to Health book, every child is given a Road to Health book when they are born. Okay, that will check their development. There is a table in the Road to Health book. If I'm not mistaken, it may be on page 23, but it's the developmental chart table. That has all the development according to the child's age that the moms can use to monitor. If you feel like there is a delay and you're not sure about it, when you go for immunization, you can ask the nurses. They usually are quite clued up on the child's development, and they will refer you to your nearest speech therapist, either in your local clinic or at a government hospital closest to you. So you, as often moms, they have this instinct. Even grandparents have it, teachers will have it too, where they know something is going on, but they don't know 100% what's going on. So bring it up at a visit with any healthcare professional, and they can guide you. But if you are concerned, if you are worried, you've noticed that your 6 month old is not really responding to their name, so you're calling and you're banging toys, and the child is not not reacting at all. Doors are banging, people are screaming, and there's no reaction from the child. It could be an early indication that the child is not hearing. Um, Also, because they're not hearing sound, they do not develop sound. So at 6 months old, they're not really making sounds. They're not even babbling. They're not going ba ba ba, ma ma ma. So there's nothing coming out. You'd have to do an assessment for them. But you would, as the mom or the grandparent, you would notice these things already. So when you go in for an assessment, the therapist will ask you, have you noticed this? Have you noticed that? Yes, no. What is your child doing? And I think often what parents and grandparents do, it's human nature. We compare kids to other kids. So, every child develops differently. We cannot say that they all are the same, but each child reaches milestones at around a similar age. So, at 1, they're starting to say their first words. So, mama, papa. If your child is now 1 year, 6 months, and they haven't even said mama or papa, you as a mom, grandmom, caregiver, that instinct of, no, something is going on. My other child said this at this age. Or, the kids at the school are already speaking, but my child isn't. So, you start internally comparing it. It's human nature, but I think that's where the first step comes in, identifying it as the caregiver, and then taking the necessary steps to move on to a clinic or a hospital or a therapist to help you.
Very interesting. Thank you so much with that. So I just want to pass the mic to the audience right there. So they're asking a question on YouTube. So Bukhosi comes and asks and say, so if a child can't speak proper at the age of 3 years, does it mean he need to go for a speech therapy, or some children, develop after the age 3? Because he realized that the girl child can communicate earlier than a boy child.
So, like I said, those first 3 years are very, very important. So even if you are slightly concerned that the child cannot speak properly or there's something going on, rather take for an assessment. You don't want to run the risk of leaving it and then your child falls further behind. Remember, when a child comes in for any sort of assessment to a speech therapist, we look at their ability to understand language and use language. So we're looking at the child holistically, the whole picture. That's what we need from the child. If the child is, even if there's a mild delay, the therapist can guide you of this is what you can do to try and get the child back to where they're supposed to be. The assessment will even tell you, no, everything's fine. It may tell you everything's fine. Your child doesn't need speech therapy right now, but I wouldn't wait. I don't advise patients to wait and leave it and see what happens. Because at the end of the day, we usually see that the child either falls further behind or they come to us and then they're struggling with more things. So rather go for that assessment. There is myths. There are things where they say boys take longer than
Mm,
girls, but you don't want to leave it again. You don't want to leave it to chance. So
yeah.
I would suggest an assessment just to guide you as the caregiver or the parent to make sure, like, my child is slightly delayed or there's a very big delay. Do they need consistent speech therapy? Do they just need a few sessions so that the therapist can guide you? Maybe the therapist will suggest schooling to you, or the therapist will give you tips of how you can stimulate the child at home. So rather get the assessment.
Oh, thank you for that. And now I want us, to debunk the misconceptions that the people have about hearing, and speech in general. But I want to start with hearing aid troubleshooting and wax removal, because some people believe that, wax is the oil that makes me hear. So why do I need to remove it? So can you please take us through that?
Sure. So, like you mentioned, the biggest myth around earwax is that it needs to be cleaned regularly or that your ears are dirty. Okay. Our earwax is a natural way of protecting, cleaning, moisturizing your ear canal. It traps dirt, dust, bugs from going deeper inside the ear. Okay. Wax naturally comes out on its own. So when we are talking, when we are chewing, when we are moving our head, different positions with gravity, naturally the wax will come out on its own. However, if you are someone that suffers with excessive wax buildup, so the wax is building up faster than it's coming out, then you need it to be removed by a professional, because then it can cause things like pain, it can block sound from going into your ear, discomfort. Some people will tell us that their ears are making a ringing noise, they're feeling dizzy. So you do want to ensure that your ears are clean, but having wax is not dirty. We just promote wax removal if you are someone that is suffering with any of the symptoms I mentioned, because you don't want to leave it and you cannot hear for a significant amount of time, because that's not it's not comfortable. Patients will tell you when they come in, I can't hear, my ears are blocked, I'm struggling to hear my child talking next to me. But as soon as we remove the wax, they feel almost back to normal. So you don't have to clean your ears, but if you have excessive buildup, like I've said, book an appointment with an audiologist like myself or a doctor, and we will remove the wax safely. Please do not use earbuds. Okay?
Mm,
Earbuds are not actually called earbuds. So if you go to Clicks or Discam, if you look at them, it says cotton buds on them. But individuals have used them for the ears for years. So the name kind of became associated as an
yes.
earbud. That's what happened. But it's actually a cotton bud. So if you are using a cotton bud, it's only meant to clean the outer part of the ear as well as behind. The rule of thumb is you do not put anything smaller than your elbow inside your ear canal. No keys, no matchsticks, no pens, no pins, nothing like that. Because you can push the wax deeper into the ear, which will cause those symptoms to get worse, or you can actually hurt your ear. Remember, your ear canal is very sensitive, it's a very thin layer of skin. And if you nick it by mistake, you can cause a cut in your ear canal, which can lead to an infection. So there's a lot of harm in doing that. I've actually had to pull out cotton buds from people's ears because it got stuck. Because when you put the cotton bud in and you twist and you twist and you twist. Somebody twisted and they pulled it out, but they didn't realize that the cotton came out. And she just threw the stick away. And when she came to me, we removed a whole cotton bud from her ear because it got stuck embedded in the wax.
Now, I
Yeah.
just wish that my grandmother was listening so that she could hear that. Leave the hairpin alone. Stop
Yes,
cleaning your
leave
ear
the
with
hair,
the
but
hairpin.
nothing smaller than the elbow goes into the ear. If you want to clean it at home, if you are concerned that you have wax build up and you need to soften the wax, just go to a pharmacy and get a bottle of wax softeners. So the pharmacies know exactly what they are. They have different names, so they could be Ceramol or Waxol, but they are wax softeners specifically for the ear. If you can't get that, you can get a bottle of sweet oil. And if you are using those, you're going to follow the instructions on the packaging for the softeners. But if you're using sweet oil, you're going to warm it slightly in the microwave or submerging the bottle in hot water so it gets warm. But it must be lukewarm. So please do not put boiling sweet oil in your ear. Test the temperature. You put a few drops in your ear. You sit up for about 10-15 minutes. Close your fastener and you go to sleep. You'll do this for about 3 or 4 nights a month, and then it will just keep the wax soft, so naturally it will come out on its own without getting hard and impacting the ear, causing hearing loss. But if you know that you have this problem, rather get it removed regularly, like a 6-month interval, to make sure that it doesn't build up to a point where your ears get blocked and you start experiencing discomfort.
Okay, so I see that you also have 8 years in public service, and you also switched to becoming a private practitioner. Yes, in private practice. So I wanted to know what inspired you to make the transition, and is working in the private sector much more better compared to working in the public sector?
So I switched for personal reasons. I have two little boys, and I was unable to manage the full time load. So that was one of the reasons. But I also reached a point in my career where I think things just became monotonous for me personally. It's not like that for all, but I mean, 8 years is a long time. And I just felt stuck in the same space and I needed a change. So I left. I worked in a government clinic in Indonesia. I worked at a government clinic in Zola, Discoveries, Orange Farm. So I worked quite a lot in the region. It was mainly based at Indonesia Clinic. And I left in March of 2023, if I'm not mistaken. And 2 months later, I decided to start private. So I really, truly enjoyed working in government. I think we always complain it's so busy. The waiting times are so long, clinics are so busy. There's so little therapists, understaffed. But I found the patients that I dealt with were just absolutely amazing. They were, even though they had to wait slightly longer, the motivation from moms that we used to run groups at the clinic. We had support groups, and I think that's what really kept me there for so long. That the patients, it was the patients that kept me long. We had issues with lack of equipment, resources, but government makes you think on your feet, makes you really adapt. You have to be flexible, smart, and if you're not getting what you need from government, you need to work around it and make it work for you. So I think that's why I really enjoy government, and like I said, I left for personal reasons. Private practice is very different. You're managing your own time, which is what I needed. I needed that flexibility. The the workload is dependent on your patient base, but it's not as crazy as working in government, because in government we were working Monday to Friday, 7:30 until 4 every day. But with government, we weren't taking work home. Whatever was happening at the clinic was happening at the clinic. In private, a lot of it does come home naturally. I'm busy writing reports. I'm planning sessions a lot more than in government. So I I think they both have this strengths. But I needed this change for myself. So that's why I left. It had nothing to do with the government or the clinics. I loved it. I loved my colleagues. I got to work with so many different professionals in government. I worked with occupational therapists, physiotherapists, dietitian, and right now, because I'm more audiology focused, I don't really work with those professionals anymore. But that skill of working with them has taught me how to pick up of if this person needs OT. Maybe a physio can help with certain things. So I learned their roles very well, not to take over their roles, but I've learned how to, refer my patients to them, guide my patients towards them. So yeah, I think that's what ultimately my personal decision was, just to leave government because of my kids. But I do miss it. But I enjoy private as well now.
Okay, thank you for that answer. So I wanted to know, so how can a mother who has a child that is stuttering, or mother who has a child that does not have the correct speech usage and is going through speech therapy, help
Mhm.
their child to develop their speech maybe a bit more faster, or make it a bit more better through even with his or her ongoing therapy sessions?
So when you come for speech therapy, often the speech therapist will guide the moms of what to do at home. Remember, whichever speech therapist you are seeing, whether it be once a week, twice a week, 4 times a week, it's only a 30-minute session. After that, the child still needs to be stimulated at home. So you are meant to be given a home program or something that you can do. It does depend on, the child's age. So if you have a smaller child, often we'll tell the moms that you need to play with the child. They learn through play, but we give them tips of how to incorporate language into that play. So a lot of repetition, naming things, pointing to things when you are, talking about things. Even if you're walking down the street, if your child is struggling with the names of certain transportation, or they're struggling to put 2 or 3 words together, we would tell them, we would guide the mom to say, okay, you are going to repeat and repeat and repeat. You are going to praise your child. So if your child says a new word, you positively praise them, because kids like that positive praise. So it's very age dependent, of what techniques to try, what you will try at home, but the therapist that you are seeing will guide you. We often work very closely with teachers as well. So we are going back and forth between teacher, mom, and myself. If there's a, we often we surround their child. So all of us need to be on the same page of what needs to be done. When you see that there's a teacher involved, a family involved, therapist involved, we often see a lot of progress with those children, because everybody's on the same page and everyone's doing similar things.
So now let's talk about common issues when it comes to your patients. As someone who is in speech therapy and as an audiologist, what are the most common issues that you hear about when your patients come to you? And please tell us what people need to do. In terms when you have to address that.
Sure. So the first thing patients will tell us is, I didn't even know what a speech therapist and audiologist does. So there's a lack of awareness of who we are and the role we play. So I think that's why, talks like this, putting it out there of what our role is in the community is really important, because as soon as a mom hears what a speech therapist and audiologist does, it kind of clicks, oh, I should have one day. So that's the the first thing that I often see. I don't do as much speech therapy anymore. I am more audio focused, like I've said. So when it comes to audiology, patients will tell us, I didn't know that I could do the testing. I didn't know that hearing aids were an option for me. Nobody mentioned it to me. So I think the issue comes with that lack of information on, the patients just not knowing who's there, who is there to help them. So I do a lot of like promotion. So I'm very active on my social media platforms, just so that patients know what we do, what are our services, so they know where to come to, because they often will go untreated for years. Where somebody will come to you and in the clinic, it happened all the time. We'd have like a 80-year-old, 85-year-old, and they'd come to you, and it's the first time that they're actually checking their hearing, and they have such a profound hearing loss, and they didn't know that we could target it or we could assess it earlier and then intervene earlier. So I think it's just that lack of knowledge of what's our role, and how we can help you as an individual.
Yeah. And now going to YouTube, there are some comments and questions from people. One of the people is Manele asking, "What is the nice sensation when I rub my ear? Is there a name for it?"
A nice sensation. There isn't a specific name for it. It's just a feeling that people feel. So they'll twist it or they'll pull it. It's just a very sensitive area. So the ear is quite sensitive. So when you are rubbing or tugging, or sometimes people will tell you they're putting like the clip in the ear and it feels really nice. It's just because of the receptors in your ear that are being stimulated. So there isn't a specific word for it. It's just the sensory sensation that you have, basically.
Yeah. Hope that answers Banala's question. And then I have Bohosi saying, "Oh, I thought you can get assist only in hospital. I'm glad to hear that even our government clinics offer speech therapy and audiology."
Yes. So I think a lot of people are not aware of that, but there are many government clinics that offer speech therapy audiology services. So you'd have to find out from your local clinics where is the nearest CHC or clinic that has the speech therapist and audiologist. You may not find the therapist there every single day just because of staff rotating between clinics, but it is available to you. So it's not only hospitals, it's your clinics as well. And often in the clinics they do screenings there. So we used to be going to our local smaller clinics and doing screenings on the babies or the kids, and then sending them to us for therapy. So it is there. Just check with the nurses, check with the matrons, if your clinic offers it, or if not, where you can go.
All right. And then Zinzi right there on YouTube ask, just curious on my side, if a child is autistic, do they attend the same speech therapy sessions to develop their speech as opposed to a child who is not autistic?
So whether your child is autistic or not, the goals will be different. So when when the therapist does an assessment for the child, that, like I said before, the therapist is looking at the child holistically. So we're looking at not just how the child is speaking, we're looking at how the child plays, how they interact, how they understand language, how they use language. So the assessment may be similar, but no two children will present the same, whether the child has a diagnosis or not. Each child is different. But we gather information from that assessment to plan therapy specific to that child. So if your child is autistic, the goals of therapy may be different for a child who's coming in for stuttering, because their needs are different. You understand? The needs are a bit different. But it's the same speech therapist that you'd come to me, for example. I read you and I have another child, but our goals are just different.
Yeah. Thank you for that. Before we let you go, another one that I want to ask you is, what is it that keeps you at night, man, in the field that you are? What is it that's something that you want to speak to us about, and that people who are listening and watching need to know about?
So I am, like I said, I'm a speech therapist and audiologist, but I love audiology. I love my audiology patients. I think that's what keeps me motivated and pushing. I'm leaning more towards that side, not much speech therapy any longer. I love that instant gratification. It's just amazing when you do the test and the person comes in and they so demotivated, disappointed, frustrated, alone, but you find out what's wrong and you get them the hearing aid, and as soon as you put that hearing aid on, you see that face light up.
Yeah.
And you see that you're no longer having to scream, and they look at you and they're like, "Are you talking normally?" And I'm like, "Yes, I'm no longer screaming." And they cry, or they can converse normally with you. It's just amazing. Like yesterday I had a patient and we did her hearing aid fitting for her, and I asked her how, we did it a week before, and I asked her, "How's it going?" And she was so happy. She told me, "I'm going to church again. I can hear my pastor speaking. It's no longer me sitting right in the front and struggling or, hitting my husband to tell me what's going on. I can actually hear what's going on. And she said even when she hears voice notes on her phone, before she'd have to put her phone like right here. And now she
Wow.
says she holds her phone, she gets her voice notes, and she can converse. She's social. So we often neglect or we think that hearing loss is just about the ears. It's not. It plays a really, really important role in our personality. So often someone that has a hearing loss, you'd notice it. They don't really talk as much. They isolate. They sit in the corner. They just nod, or they say yes, yes, but they're not actually engaging.
Mm.
And for someone to lose their hearing, they often lose a part of themselves because
Yeah.
they no longer that person that they were before. They
Yeah.
no longer that social butterfly that they were. And now we giving that back to them. And I absolutely love that. That's
Mm.
what drives me. My audiology patients and those hearing aids.
Yeah.
When I give it to them, it's just amazing. It's nothing that I can describe. I think I'm trying to do a good job of it, but it you have to be there
Yeah.
uh, to see that the face lighting up.
Mm.
Yeah, that's very amazing. So, just to read out some other comments on YouTube, we have a comment from Ziad Mohammed, and he's sending out a heart with like a cross in the middle there. I bet you know who Ziad is. And
That's
then we
my
also And then we also have another comment from Bukosi, and he's saying, "Hope to see you in Vooka Breakfast Show Career Day, which is
husband.
coming up." And then we also have another comment from Kairon Jada, and he says he loves this. And another comment from Radzilani, and he says, "Thank you, Vooka, for bringing us people who educate us because I love learning. I am learning a lot about speech therapy."
Mm.
Wow, that's amazing. So yeah, thank you so much for having me.
Yeah.
I've really really enjoyed this. My details are all on you guys. I think you put it up. I've been seeing it come up a bit.
Yeah.
Um, if patients or individuals have any questions, they are more than welcome to send me a WhatsApp and I'll guide them. I'm not doing as much speech therapy as I used to, but I can guide them to therapists that may be able to help them. I can guide them towards local clinics if they need that.
Yeah.
Um, but I am an audiologist. That is what I'm practicing as currently. So my details are there, whether it be for wax removal, hearing tests, hearing aids, hearing
Yeah.
screening. Uh, Feel free to contact me and I can help and guide as much as possible.
All right. Just before we let you go, I have this other friend of mine, and I hope this will be helpful for him because he's someone who's loud when he speaks. Like when you are just in front of him,
Yeah,
just a little bit distance from, but
yeah.
he's always loud. What's the problem with those people? He can hear from a distance. When I'm there, when I call him, he can hear me. But now
Mhm.
he has this thing of being loud. Do we have a condition for those people, or they're just like that?
It may just be his personality. Sometimes people are eccentric, where they just, they need to be the center of attention and they raise their voices when they talk. He could have, hard to say, but he could even have a slight hearing loss. That's why he's raising his voice slightly. I don't know his age or anything like that. So it may just be personality. If he's listening to lots of loud music with earphones, also sometimes they can cause temporary difficulties, and patients have to talk louder because
Yeah.
they think they talk at a normal level. So it's hard to say, 100%, but it could be personality, it could be hearing loss, either one.
Yeah, yeah. Thank you so much for that insightful conversation, and I'm sure our viewers, learned a lot about speech and hearing health today. We appreciate you spending your morning with us.
Thank you so much for having me. And I really want to know about this career day. So
Yeah.
be in touch.
Yeah, thank you for spending time with us.